There are a lot of myths about vaccinations. Let's talk about this one.
I'm healthy. I don't need vaccines.
Let's debunk this myth. If you're healthy, it's most likely isn't by accident. A lot of things factor into your good health, like exercise, diet, getting enough sleep, making healthy lifestyle choices, and getting regular checkups. Yet none of these things will prevent you from catching the flu or developing shingles or coming down with pneumonia. These diseases are caused by viruses or bacteria. At best, if you catch a virus or develop pneumonia, you will most likely become ill. At worst, you could end up in the hospital or even die. And once you contract a virus, there's a very good chance that you'll pass it on to anyone who isn't protected by vaccines. Additionally, in a time when someone can travel around the world in a day, it's easy to see how fast and far a disease can travel, just like we've recently seen with Ebola and Zika. I've heard people say that it's really improved hygiene and good nutrition that has lowered the incidence of vaccine-preventable illnesses. I agree that those two things have made a big difference in people's health. However, if you look at the numbers, the number of people who were ill before the introduction of a vaccine and the number of people ill after the introduction of the vaccine, you will see an overwhelming reduction in the number of people who've become sick. Vaccines are responsible for the largest declines in the rates of these diseases. Having trouble believing this? Well, let's look at the facts around measles. Between 1950 and 1963, between 300,000 and 800,000 people a year in the United States came down with measles. Then a newly licensed measles vaccine went into widespread use. By 1965, U.S. measles cases had dropped dramatically. By 1968, only 22,000 cases of measles were reported. This was a 97.25% decrease in the number of cases in just 3 years. Well, let's fast forward to the 1990s, and the number of measles cases averaged about 100 per year or less. The reasons we are now seeing a rise in measles is that people stopped getting vaccinated. Would you like another example that vaccines and not improved hygiene and nutrition are responsible for the sharp drop in disease and death rates? Well, let's look at chickenpox. If hygiene and nutrition alone were enough to prevent infectious diseases, the number of people who contracted chickenpox would have dropped long before the introduction of the varicella vaccine, which was not available until the mid-1990s. Before the varicella vaccine was introduced in 1995, the number of chickenpox cases in the United States was about 4 million a year. By 2004, the incidence of chickenpox had dropped by about 85%. Just because you're healthy doesn't mean you won't contract a vaccine-preventable infection. You could still become infected and then pass that infection along to a family member, a loved one, or a coworker. And think about this. If you're not protected by vaccination, you could become infected by a random stranger in the grocery store or shopping mall or any other public place for that matter. While infants and the elderly are at a greater risk for serious infection and complications, vaccine-preventable diseases can strike anyone at any time. If you're healthy, getting vaccinated can help you stay healthy and should be considered as part of your overall health regimen, along with diet, exercise, regular checkups, and making healthy lifestyle choices. Remember, vaccines are among the most convenient and safest preventive care measures available. Being vaccinated could mean the difference between life and death for you and others. Once you have the facts, it's easy to see through the myth to the truth. Talk to your doctor and get the facts about vaccines, and do your part to protect New Jersey.